the shortage of staff, you all talked about this last year. So it's still happening. Can you talk about in what specialties? What's the problem?
Yes.
And yeah.
Yeah. I mean, I think from entry-level positions all the way up, we're just not seeing the same volume of applications coming in for the house-wide jobs that usually were easier to fill. There's a whole lot more competition on that entry level than there ever was before. If you're going to pay $24 to work at Amazon, it's, in some ways it's a lot easier than being a transporter on a very busy surgical unit. So it is, I think for all of us, we are in the process, as well as a nation, of trying to determine how best to send those messages to help people who are attracted to come and serve fall in love with healthcare again.
And I don't think we can ignore the impact of burnout and some post-traumatic stress that I think many of our colleagues are dealing with, that's causing people to choose other industries other than healthcare. Losing tenured people that have basically said, enough is enough. And so we're having to sort of rethink not just recruitment and hiring practices, but retention strategies. How do we keep and nurture the staff that we have?
Yeah, I think in the past, we used to think about our competition as other healthcare systems or other healthcare jobs, but now we're competing with all of every industry out there in order to maintain people who are, a third of healthcare workers are thinking about leaving healthcare. So we are competing not only with other healthcare systems, we're also competing with all of these other industries. We should have a big advantage if we play our cards right, which is what we do. It has a profound purpose to it. And that if people are looking to switch jobs because they want something with more purpose, which is what you're hearing in a lot of other industries, we want to make sure we show people the things that we do that are very special and unique in healthcare. We tend to think about how much people are burned out from the intensity of the pandemic, but still what we do is very, very special and unique. And I think we have to highlight that in order to attract people to come into healthcare.
One of the greatest examples I saw this week was Walmart. So there's a shortage across the country with clinical trials, and there's great clinical trials that are out there. A lot of us provide them to our community members as alternative therapies. And now Walmart is becoming the leader in clinical trials. On the one hand, it's really good because there's 90% of Americans who live within 10 minutes of Walmart. But it's a good example of how previously nobody would have gone to Walmart to be a research coordinator or to coordinate clinical trials. That would have been with academic health systems like ours. And so that's an example of how there's just a whole new ground of competition that we never faced before with especially retail and the retail operator. So it's not just the lower level positions or the entry level positions, but it's actually for the more technically advanced scientific positions as well. So it's going to require us to really rethink how we approach this in the future.
And Marianne, I would say, as I look at my colleagues, each of us are finding ways to implement the things that we stood up very quickly during the pandemic, because consumers are demanding a whole new experience with us. Going to digital, finding ways to meet them where they are, hospital at home, pick any one of those things. It's now becoming expected. And I think the consumers are driving as much of the changes in healthcare. And so that allows us to really look at our entire workflows, look at how the options that we give to people, see if there are ways that we can restructure jobs. But all of that takes time and training and just focus as at the same time we're trying to do everything else. So it is a wonderful opportunity, exciting opportunity, as long as you like change.
But it has forced us to sort of rethink some priorities. And I think one of the things that we're having to do is make the sort of physical, mental, and emotional well-being of our colleagues a priority, and how we address them within our own shops. And so, and I don't think that we ever not thought about doing those things, but without question now, they are much more of a priority.
But Dennis, can you imagine that we would actually have conversations with people about their mental health on the floor, real time? I mean, each of us are doing that now because we have such a fragility amongst our workforce. So things that you would have had to have 4 meetings with HR and plan out how you're going to have a single sentence conversation now happen automatically.
But Amy, I think part of the reason is those of us that are in healthcare and our frontline workers, they're sort of wired to help people, right? And so they have difficulty sort of stepping away or shutting it off. And sometimes that's at the expense of self-help. And so now we're starting to have those conversations about how do we get people to focus on their own well-being when they are so much so involved in the well-being of others. It's difficult to get people to go against their natural order.